moving on to the pelvic girdle and pelvis. So the pelvic girdle includes just the two hip bones, right? If you're going to say pelvic girdle, you mean just the two hip bones. But if you're going to say pelvis, that includes the pelvic girdle, the sacrum, and the coccyx. The pelvis supports the body while standing and allows us to walk and run. It protects the organs of the pelvic cavity and the fetus in a pregnant woman. The pelvis has many attachment sites for the large muscles of the buttocks and the thighs. Here we see the pelvis seen in a lateral view, and then we see it seen from an anterior view in the picture on the right. That's actually an X-ray of the pelvis and the lower limb. The hip bones are formed by the fusion of three bones, the ilium, the pubis, and the ischium during development. At birth, hyaline cartilage separates the three bones. Fusion of the three bones is usually complete by age 25. So it really does take time, but it's important that there be a way for the hip bones to grow as a person grows in, an easy way. So they're not completely connected until you are 25. The hip socket is called the acetabulum, and it's formed by all three of the bones. Right. And if you look at this picture is great. It's from Martini's. It's a lateral view. It's showing you that the ilium is the superior purple shaded bone here. The pubis is the anterior pink bone, and the ischium is the inferior posterior bone in yellow here. All right. And the acetabulum, the hip socket, is formed by all three. Okay. Like sort of an equal measure. If you made it into a little pie, they're sort of equally share being part of the acetabulum. Then there's the big hole in the hip bones, which is called the obturator foramen. And the obturator foramen is actually covered by a sheet of connective tissue that is an attachment point for hip muscles. The obturator foramen is formed by only two of the bones. It is formed by the pubis and the ischium. So you see only the pink and the yellow bones here are forming the ring that surrounds the obturator foramen. So fine, later on when we learn muscles, we'll learn what muscles attach to the connective tissue sheet that covers the obturator foramen. There is also a little passageway that allows the obturator artery and nerve to pass through the obturator foramen to leave the pelvic cavity. It's not a complete solid sheet of connective tissue. Okay, so now on to the ilium. The ilium is the superior part of the hip bone. The iliac crests are the tops of the ilium bones. When you put your hands on your hips, you're putting them on the iliac crest. The anterior superior iliac spine, which is often abbreviated ASIS because it's hard to say anterior superior iliac spine, is the most anterior point of the iliac crest. And this is the point of the hip bones that you, if you're ever against like a high counter and you hit your anterior hip and, it hurts a little bit, you're probably hitting your anterior superior iliac spine because that is the part that is most anterior and most likely to get hit by a counter. Okay. The iliac fossa is the large, shallow depression in the ilium bones that supports the abdominal organs. The arcuate line is its lower border. So they look like these big, giant, elephant ears, or they're like soft, big cups that you can't miss when you hold the hip bone. The two ilium bones articulate with the sacrum posteriorly at the right and the left sacroiliac joints. And this is another one of those joints that has a great name where sacro is for sacrum and iliac's for ilium bones. So the sacroiliac joint is obviously the joint between the sacrum and the iliac bones. The weight of the upper body is transferred through the sacrum, which is the bottom of the vertebral column, and then through the hip bones to the legs, or let me say the lower limbs, because the legs actually means the lower leg, the lower limbs. There is like a sharp looking upside down U shape as part of the ilium, and that's called the sciatic notch. The sciatic notch allows the sciatic nerve to exit from the pelvis. So you see that in the posterior of the ilium bone. Okay, so that was the ilium. Now moving on to the pubis. The pubis is the anterior and inferior part of the hip bone. It has a superior and inferior ramus. And remember, ramuses were parts of bones that were at a sharp angle to another part of a bone. So here we have our superior pubic ramus here, and then here we have the inferior pubic ramus. And just looking at the two small pictures where they have colored the bones different colors and the pubis is pink, you can see that whereas the superior pubic ramus goes all the way across to the ilium, the inferior pubic ramus goes only part of the way, and then you get into the ischium bone, and the ischium bone has a ramus of its own. So the two pubis bones articulate at the pubic symphysis. Remember, symphysis is a type of joint that contains that pad of fibrocartilage that we learned about when we were learning cartilage. And just FYI, because I'm a former OB-GYN, during pregnancy, a hormone called relaxin decreases the density of collagen fibers in the fibrocartilage of the pubic symphysis, and that allows the joint to widen, and the pelvis can widen in preparation for childbirth so that the huge baby head can come out of the pelvis. Okay, and now on to the ischium. The ischium is the posterior and inferior part of the hip bone. It is the strongest of the hip bones. It's sort of more massive. You can notice when you look at your hip bones from your bone box that it's kind of thicker, more massive. And the interesting feature in the ischium is the ischial tuberosity. We sit on the ischial tuberosity, okay? In yoga or gymnastics or in dancing or in things where you're sometimes doing floor exercises, they'll sometimes call the ischial tuberosities the sits bones. Sit on your sits bones, they'll say. You can feel while you're sitting, you can pat your bottom and feel your ischial tuberosities. Okay, now a bit about the pelvis as a whole. The pelvis is divided into the greater or false pelvis and the lesser or true pelvis. I like to call them greater or lesser rather than false and true. It just starts to seem like kind of moral or something. So, here I have the picture showing the greater pelvis and the lesser pelvis and showing that they are separated by the pelvic brim. And the pelvic brim is formed by multiple parts of multiple bones. It's formed by the prominence of the sacrum, the arcuate line, and the pectineal line on the hip bone, and then the superior margin of the pubic bone. The greater pelvis supports the abdominal organs. It has the iliac fossa on either side, right? The lesser pelvis protects and supports the pelvic organs. The pelvic inlet is the plane enclosed by the pelvic brim, and I'll show you pictures in a bit showing you the pelvic inlet. And the pelvic outlet is the plane that is bounded by the coccyx, the ischial tuberosities, and the inferior border of the pubic symphysis. The head of an infant must pass through the pelvic outlet, and this is the toughest spot. This is the bottleneck. This is where you wish you had more room. This is a picture of the pelvic inlet on the left. That's the red dotted line. And we're looking anteriorly, superiorly here. So when I said there was a plane that was bounded all around by the pelvic brim, this is the plane of the pelvic inlet. And then now we're looking from a very different view. This is from an inferior view of the pelvis. So, this is the obstetrician's, gynecologist's common view, where you're looking up, between the legs of the person from their feet to their head here. Okay. And this would be the pelvic outlet. And notice how the pelvic inlet is bigger than the pelvic outlet. It's a more constricted space or plane or area. Okay. Now, on the bottom, are we just a hole at the pelvic outlet? No, of course not. The pelvic outlet is filled with the pelvic floor muscles that are supporting the pelvic organs, and that include the urethral and anal sphincters, okay? And here's a picture of a female inferior view of the pelvic floor muscles, and Here's a picture of a male inferior view of the pelvic floor muscles. And then over here, we're seeing that each of these pelvic floor muscles has to be attached to a bone. And there are multiple origin sites being shown on the pelvis in this inferior view of the bones of the pelvis over here. We don't actually learn the pelvic floor muscles individually, but they are down there holding our pelvic organs from just falling down between our legs. Okay, so the male and the female pelvis, more about the male and the female pelvis. So the female and male pelvis differ more than any other structure in the skeleton between, women and men. An anatomist or a forensic pathologist can identify if a pelvis is female or male 97% of the time. The female pelvis is broader, shorter, and lighter. It has a wider, rounder pelvic outlet and a less curved sacrum and coccyx. The pubic angle is wider, greater than 100 degrees, and these differences are evolutionary adaptations to childbirth, okay, or to carrying a fetus around. So here you can appreciate, looking at these two pictures, how the female pelvis is broader, shorter. They mean from the superior to the inferior, it is shorter, okay? Whereas the male pelvis is narrower and taller, okay? I'll show you a lateral picture and you'll see that there's a less curved sacrum and coccyx. I already showed you that when we were learning the vertebral column. And then the pubic angle is underneath the pubic symphysis. That angle is what they're talking about, and it is wider, greater than 100 degrees in a female pelvis, and is usually 90 degrees or less in a male pelvis. And then here are other pictures showing you some of those features. Again, showing you the pubic angle is narrower in a male pelvis than a female pelvis, showing you that the sacral curve is different in a male pelvis, where the sacrum and the coccyx can curve more anteriorly, whereas the female sacrum and coccyx are more posterior and pointing less anteriorly and more directly towards the ground. This particular picture, it just kind of big picture it because they almost make it look like the female sacrum and coccyx is more curved, but don't be fooled. It's not more curved into the pelvic outlet. It's just, I don't know, drawn that way or whatever. If you look at the pelvic outlet is more obstructed in the male pelvis in this picture here. And then they're showing you that the pelvic outlet in the male is tinier than in the female pelvis. So cool. All right. So now let's move on to the lower limb femur. So the lower limb, it has in it the femur, which is called the thigh, the patella or the kneecap, the tibia and the fibula that are in the leg, the tarsal bones that are in the ankle, the metatarsal bones that are part of the foot, and the phalanges or the toe bones. So the femur, it's the longest, largest, and strongest bone in the body. The large head of the femur fits into the acetabulum of the hip bone. There's a pit in the head of the femur called the fovea capitis, which contains a ligament that connects to the acetabulum. So I always think of back, I don't know if they still have this in little dolls, but they would have like a little piece of elastic that held the little baby doll's legs into the hip bones, and like you could pull them and like sometimes by mistake you'd pull the whole leg of the baby doll off. But anyway, there's this ligament that goes between the fovea capitis and the acetabulum. And the ligament helps to stabilize the position of the femur and, I suppose, keep the femur from completely dislocating from the acetabulum. The acetabulum is a pretty deep cup. It's not like the glenoid cavity, but this is an extra precaution that really keeps that femur head in the acetabulum cup. Okay, then the neck of the femur, now this really looks like a neck, is distal to the head. You see that here, just distal to the head. The greater trochanter is lateral to the head and the neck, and the lesser trochanter is inferior to the head and the neck. And both the greater trochanter and the lesser trochanter are attachment sites for muscles that we'll learn when we learn muscles, what exactly they're attaching to. The shaft of the femur is massive and strong. It curves slightly laterally along its length. The curve helps weight bearing and balance. Then the linea aspera is a bone marking that runs down the posterior femur. It is an attachment site for muscles. And then we get to the distal epiphyses of the femurs that have lateral and medial condyles, which are round surfaces that articulate with the tibia. Outside of the condyles are the lateral and medial epicondyles. And these also you can feel just as you could feel the lateral and medial epicondyles of the humerus. Okay, patella bone next. The femur has an anterior patellar surface that articulates with the patella. The patella or kneecap is the largest sesamoid bone in the body. It's broader superiorly than inferiorly. It sort of, but not really, looks like an inverted triangle. At birth, the patella is a cartilage model within the tendon of the quadriceps femoris, and then it develops into bone over the first few years of life. The patella protects the anterior surface of the knee joint, and the patellar ligament extends from the inferior patella to the tibia. Now, we didn't learn muscles yet, so I will explain. The quadriceps femoris muscles are the four anterior thigh muscles that extend the knee, and the patella relieves stress on the quadriceps tendon, which otherwise would have to go around this big curve to get to the tibia. The patella increases the force that the quadriceps femoris creates during extension of the knee joint. Okay, so that was the patella, now the tibia and the fibula. So the leg, which is what we think of as the lower leg, it has two bones, the tibia and the fibula. The tibia is larger and it is medial. The superior surface of the proximal epiphysis has lateral and medial condyles that articulate with the condyles of the femur. The intercondylar eminence is an elevation between the condyles. And you'll see it clearly when you look at your tibia, that there's this little like knob or knuckle or a teeny like little hill that is between the lateral and medial condyles. And it has its own special name, the intercondylar eminence, which I think is a very nice and fancy name. Okay, on the anterior surface of the proximal epiphysis of the tibia lies the tibial tuberosity, which is the attachment site for the patellar ligament. This is very easy to feel on your anterior tibia. Moving inferiorly, the anterior border of the tibia, what we call the shin, is sharp. It is an attachment point for the deep fascia. And this is another thing that you can feel very easily. We can all feel the sharp anterior border, margin, shin of the tibia. People use different synonyms for it, like border and margin, sometimes you'll see. And here's a picture to the right in the middle, showing you how really quite sharp that shin bone is anteriorly, the tibia bone anteriorly. The view in this picture is that you're looking, this is a right leg cross section, and you're looking as though you were looking from the head downwards towards the feet. So that's why the tibia is, how should we say, on the left in this picture, because it's the right leg, we're looking down, and the tibia is more medial in our leg. Okay, the interosseous membrane, a sheet of connective tissue, connects and stabilizes the tibia and the fibula, and the interosseous membrane is an attachment site for muscles. The distal epiphysis of the tibia articulates with the talus, the proximal tarsal bone of the ankle. The distal epiphysis is wide, and it has a medial projection called the medial malleolus. Malleolus is a word for hammer. We learned that the malleolus bone in the middle ear is called that because it looks like a hammer. But here's another malleolus, the medial malleolus. And note that here we have our tibia, the distal epiphysis is wide, and the medial malleolus is very prominent bone marking, and it's easily felt in your own leg. It's one of the two little bulges that are in our ankles. This would be the medial bulge. And the purpose is it's attached to ligaments. The medial malleolus is attached to ligaments, and it prevents the tibia from sliding laterally across the talus. You can think about that. We wouldn't want our tibia to slide laterally as we went through uneven terrain or anything like that. Okay. All right, now the fibula. The fibula is the lateral bone in the leg. It comes from a word that means the pin of a brooch in Latin. It's much more slender than the tibia. You will see that they are very different in size when you look at your bone box. The head of the fibula does not articulate with the femur. It articulates only with the tibia. The fibula helps support the leg and the ankle, and it's an important attachment site for muscle. The distal epiphysis of the fibula does articulate with the talus ankle bone, and the distal epiphysis has a prominent projection. The lateral malleolus stabilizes the ankle joint by preventing the fibula from sliding medially across the surface of the talus. It's an attachment point for many ligaments, and we see it over here, the fibula and the lateral malleolus. All right, onward to the ankle and the foot bones. There are 3 sets of bones in the ankle and the foot. The tarsal or ankle bones, there are 7. The metatarsals or foot bones, there are 5. The phalanges or toe bones, there are 14. The structures of the ankle and the foot and the wrist and the hand are similar. And here, again, I did the same thing. Tarsals, I marked off with a black line, and then metatarsals with a red one, and then phalanges with a black line again. The tarsal bones are found in the posterior half of the foot. The talus is the large bone on the top of the other tarsals that articulates with the tibia and the fibula. The calcaneus is the heel bone. It's the largest tarsal bone. It's just inferior to the talus, and it extends posteriorly well beyond the talus. It's the attachment point for the Achilles tendon of the gastrocnemius and the soleus muscles. These are the only 2 individual tarsal bones to learn. We didn't learn any carpal bones. These are really the only 2 bones in the tarsal set or the carpal set that you are learning. The metatarsal bones are found in the middle of the foot. They are long bones. They're numbered 1 through 5 in Roman numerals. Metatarsal number 1 is proximal to the big toe, and then metatarsal 5 is proximal to the pinky toe. The tarsal bones and the metatarsal bones together form the arch of the foot, what we think of as the arch of the foot. There are 3 groups of phalanges or toe bones in each foot, and this is analogous to what we learned about the finger bones. There are proximal phalanges 5, middle phalanges 4, and distal phalanges 5 again. The big toe does not have a middle phalanx. The phalanges are long bones. Even the tiny tip of the pinky toe is considered a long bone, even though it's very short and tiny. It's not a short bone, it's a long bone. The big toe digit is numbered 1, like the thumb digit is numbered 1, and then we go across in normal, 1, 2, 3, 4, 5, until we get to the pinky toe digit, which is 5. Okay, and remember, toes are digits. Phalanges are individual tiny bones within digits. Okay, a little bit on fractures and bone healing.